Hi, I'm Taylor Harrington, Senior Data Analyst with PolicyMap. PolicyMap works to make data and mapping accessible to all through our self-service online mapping software. We also work closely with partner organizations to integrate their own data as they ask questions about and build solutions throughout the communities in which they work. We work to address a few challenges in data and mapping for projects like yours. Data can be difficult to find, confusing to access, and can take a lot of work to clean, maintain, and continually update. Geospatial software can be prohibitively expensive, sometimes usable only by trained analysts, and isn't much use without access to the data you need. Data provision is helpful to describe things like census data, for example, questions of demographics or incomes in your community, but doesn't often tell the full story of the on-the-ground knowledge held by those who live, work, and organize locally. The goals of our partnership are to share knowledge and develop solutions with mapping. PolicyMap aims to make data more democratic, accessible to those without mapping and data expertise, as well as the larger community audience. We were recently part of a session with Baltimore Harm Reduction Coalition and Legal Action Center to talk about opportunities for their own data integration and making use of PolicyMap's data warehouse. Specifically, goals for this partnership include making local data more accessible to those engaged in harm reduction work in Maryland, finding intersections where communities have unmet need, where harm reduction work is accessible to those who need it. Communicating data, using data to self-assess strategy development and sharing wins along the way. And building consensus and illustrating benefits of harm reduction strategies to the larger community and elected officials. In the upcoming examples, we use data provided by Baltimore Harm Reduction Coalition, a listing of syringe services locations and overdose response program locations. This is the exact type of hyper-local, on-the-ground knowledge that only those working in the space can share. This is not available through a census website for download. By intersecting this data with other indicators from PolicyMap's database, we can ask questions about communities in which you live and work. What are the demographics of the areas we serve? Where can we identify unmet need? And, in connection with Advocacy Institute's work, how can we organize this knowledge to impact legislative outcomes? Check out this first map in Maryland. I've loaded ORPs in Baltimore City. We have intersected ORPs, the green triangle, with other indicators of potential unmet need. Here, we are displaying areas that have, in different care categories, been determined to have a shortage of health professionals. There may not be enough services provision in these areas to serve the population living here. In particular, I'd like to highlight areas in brown that have been ID'd as areas where primary care, mental health, and dental health are all underserving their populations. PolicyMap also has similar data on other potential unmet needs: access to grocery stores and public transit, data on economic indicators like jobs and wages, and much more. Looking at the next map of SSPs in Maryland, we have layered here with the estimated per capita income displayed at congressional district boundaries. This will be a quick way to communicate data with electeds. You can see here clearly and download for your own use outside of PolicyMap that Maryland's 7th district contains a cluster of SSP locations in Baltimore and has per capita incomes at around $38,000 annually. Think about ways that you might use this data to communicate those with those in the elected official space. Lastly, this cleaner map showing only points can help to talk about spatial relationships between service providers like ORPs and FQHCs, Community Federally Qualified Health Centers. A map like this may be a good illustration of partnership building using PolicyMap when you'd like to communicate proximity to other health services in your neighborhood, like hospitals, mental health clinics, libraries that provide community services, public schools, and much more. Thank you for your time and partnership. We look forward to continuing this important work with you and appreciate the fact that you've included us in this project.